now. You have team members that weren't able to join today, or if you'd like to look back through the materials, we will be sending out the recording, and also we'll be posting it as well for folks to see. But again, thank you all so much for joining today. As I mentioned, I'm Nimish Shukla. I'm one of the co-founders and the COO here at Liferaft. And today we're going to be talking about our latest white paper that we published really on health insurance trends in 2024. So we're going to talk first about some of the major kind of changes and trends that we've seen in the fully insured group health space, and then particularly focus on those areas of opportunity where we as brokers and advisors that work with employers can really provide alternative, creative solutions that are going to help provide some level of both, I think, solutions to employer challenges, but also with a really key eye towards cost containment, which is a continued kind of trend that we are definitely seeing in the group space. So let's go ahead and jump in. I should mention, just sorry, one last housekeeping item. If at any point a question comes up during the presentation, please feel free to drop it into the Q&A. I will save time towards the end to go back through and answer any questions that have come up today. So let's go ahead and get started. So as I mentioned, we're going to be talking about the fully insured group space, and probably not a surprise to anybody that's here today. Rising premiums continue, right? So those employers that are either in the small group or the large group market, we're continuing to see those increase in costs year after year after year. When you're looking at kind of year over year, right? 2024 over 2023, on average for, a single employee, we're seeing coverage increasing about 6%. And family coverage going up a little bit more than that at 7%. I think this is meaningful for two reasons, right? Number one, it's outpacing both inflation and wage growth. So as we think about companies that are having to make a decision about what benefits are going to be offering, as we see these continued annual re-rates and increases happening, at some point there's going to be real cost pressure that's going to create a systemic shift in how employers are thinking about offering health insurance. We know employers are going to continue offering it. It's mandated if they're over 50 full-time employees. But in addition, I think it's a really key aspect of a benefit that's provided through the employer channel. That being said, at some point, the cost pressure is just going to become too much for employers, right? If you look at what a 6 to 7% increase doesn't feel unsustainable year over year. Oftentimes, companies can find the budget. If I have a $100,000 budget, what that really means is I'm looking at about $106,000 next year. Those numbers don't feel unreasonable. But if we look at this over time and in 5 year increments, you're actually seeing a pretty meaningful change in premiums over 5 years. And that's where the numbers become really, really dramatic for both companies, but also for employers, right? Now, we've seen employers eat a brunt of that over the last 10 years. So from 2019 to 2024, I think, the important thing to keep in mind here is three things. One, there's been a 24% total premium increase. So if you're a small or average size employer in this country today, you've seen your healthcare costs rise 24% over that 5 year period. That's very expensive. But we're also seeing that employers are the ones that are actually eating a majority of those increases, right? They've actually chosen to absorb, a large part of the premium increases that they've seen, because worker contributions have only increased about 5% over that same period of time. That's an advantage for the employees, right? We want to make sure that employees are getting affordable coverage. And today, when a group is seeing that increase, oftentimes they're absorbing that and not passing it through to their employees. So really one of two things could happen over the next couple of years. Number one, employers are going to have to recognize or will recognize, hey, if we continue to see these sorts of premium increases, we have no choice but to pass some of this cost through to our employees. The second is they're going to start looking for alternative options so that they really get off kind of this hamster wheel of, hey, we get to renewal. This year, you're at a 10% renewal. I quote you out to all of the other carriers. The best we can do is about a 6% renewal increase if we switch carriers. I think employers have finally gotten to the place where they're seeing the model has become a bit unsustainable for them. And over time, they're really going to have to make alternative decisions. Um, from a coverage perspective, right? Um, what have we kind of seen there, right? Premiums have continued to rise. We know that. The good news, I think, on the coverage side is that deductible growth has stabilized, right? I think that's likely to, continue to be the case over the next couple of years. Although, because really what we're seeing is carriers are passing through that cost increase through premiums, right? The other way that we might see carriers start to recoup some of these cost increases is through deductible coverages, right? One of two things has to be true. Either premiums are going up because it's getting more expensive, or cost sharing for the employees is going to have to start going up. And what that's going to do is effectively stabilize the premium side. So, what we've really seen over the last 5 years is carriers have chosen to pass through premium increases absorbed by employers and have kept deductibles relatively stable over the last several years. Um, I think, no surprise here, right? If you're in the small group space, you're seeing higher deductibles on average when you compare those to the large group market. So large group markets that might have higher budgets. That market is a little bit more robust. You're going to see richer coverage there, smaller deductibles for the employees. In the small group market, you're going to see a slightly higher deductible. Um, I think the other interesting trend here that's something to keep in mind is this is really where cost containment has started to come into play, I think, at an increasing trend. So employers understanding that the cost sharing piece and the burden for employees, is a really key piece of their health insurance and their benefit platform, are starting to contribute to HRAs, right? So that they can actually help meet some part of uh, deductible coverage for their employees. So, that's one of the things we've seen on the HRA side, and we'll talk more about this. But when paired correctly, you can actually use an HRA to reduce kind of overall utilization, but ultimately provide a richer level of coverage for your employees, and maybe do it at a pretty cost-effective way. Um, Without having to completely change or overhaul your group health insurance plan. But, I think the key takeaway is if we look over the last year and look over the last several years, what we've seen from the carriers is a decision to really drive premium increases, keep deductibles stable. And over the next several years, we might see a bit of a shift in that, or potentially see both premiums increasing and deductibles increasing, which I think really makes the fact that we as benefit advisors need alternative solutions to be able to present to our employers at the time that we're looking at renewals. So let's talk about a couple of other kind of key interesting trends I think that have been widely discussed, widely talked about, and can potentially impact utilization, especially for those groups that are going to be in the large group market and are medically underwritten, right? The first one that there's been a lot of chatter around has been GLP-1 drug usage, and I think that continues to be the trend. It started, I would say, kind of late 2022, early 2023, has continued through this year, just given how high utilization has been on GLP-1s. I think when you look at employers that have chosen to really take a decision on GLP-1 coverage, the number still isn't very high, and it's not a huge surprise that we're seeing that. So in kind of the enterprise space, right? When we talk enterprise, we're talking employers that have 1,000 or more lives. Only 25% of those employers are going to have made the decision to cover GLP-1s. And um, again, not a huge surprise given utilization and potentially continued use, right? One of the things that we see when you're looking at the prescription drug piece of any sort of health plan is sustained utilization of prescription drug benefit can in fact drive premiums up. And you see that with groups that have individuals that may have a chronic condition, right? Whether it's diabetes, whether they've been diagnosed with cancer. Oftentimes, what's happening is there's a high utilization on the health piece, but there's also a very high utilization on the pharmacy benefit. And that can actually drive premiums more than we think. And so I think from the employer space, what we're really seeing um, is, a vast majority are going to continue kind of seeing how this plays out, not covering GLP-1s, putting that burden really onto the employee. Because for about half of the employers that have covered GLP-1s, they have seen a significant increase in prescription costs, right? So we know when people are utilizing these drugs, it's going to drive utilization, or it's going to drive costs higher. And, unless there is I think, a large systemic shift in how either the industry is looking at this, if there are other medications that are kind of off-brand GLP-1s, although that, seems to be several years away given where we're at in the cycle of those prescription medications. I don't know that there's going to be a huge shift here. But again, for those employers considering adding GLP-1 coverage, we are seeing that that can drive costs a little bit higher. The other point I want to mention here is in addition to the cost component to the GLP-1s, we are seeing um, we're seeing for um, that number of kind of coverage really starts to tier up depending on the size of the worker. And that's really no surprise, right? Especially as we move into the 5,000 or more lives. Oftentimes, you're not looking at a fully insured group, you're looking at a self-funded group. They have, potentially they may have a little bit more flexibility on PBM relationships, how drugs are priced. And so you're going to start to see those large groups really start cover some of these higher utilization medications that some of the smaller groups may choose not to do. Let's talk about another one, which is really expanded family building services, right? So as we think about, over the last several years, I think there's been an increased awareness. There's been an increased discussion around family planning services, particularly IVF, and medications that go along with IVF, in addition to adoption. And in 2024, there's actually been a bit of an increase across the board on covering all of these categories. And we're seeing, fertility medications have really been the biggest, I would say, driver of coverage there. But IVF has also, started to increase. I think the challenge that we see in this space again is a lot of times, employers are unsure of what utilization is going to look like. And when you're on a fully insured group health plan, if you are going to be offering a fertility rider, for example, to cover pieces or all of the things that are covered here, what you're going to see is you're going to see a premium increase across the board for adding that fertility rider. Now, if you have low utilization of the fertility rider, you've effectively now increased everybody's premium for something that only a few people may need. And so we really see this area as a massive opportunity for benefit advisors where, there are other flexible funding arrangements that can be brought to the table that really help keep costs me- uh, reasonable for employers. It doesn't increase the entire employee population's premium if you're increasing it, but also provides a benefit, especially as this awareness continues to grow, as we've seen over the last couple of years. What about abortion coverage? That's another big one with everything that's been happening over the last couple of years. What we've seen kind of year over year is that number has gone down a little bit from 32% to 29%. So it's still not a majority of the market, but you are starting to see firms really start to think about and cover um, abortion care. Now, that broader number is a piece of the market that is, where legally provided abortions are covered in a majority of cases, or pretty much in all circumstances. You do have a narrow piece of the market that's also providing, legal abortion coverage in very specific cases. So that number has trended down a little bit. We're going to have to see what happens as we move into 2025, given the shifting landscape. It's going to be interesting to keep an eye on this. But again, this is an area where groups always have the ability and the choice of adding specific coverage to their fully insured group, if or fully insured group health insurance plan, if they're on that, or to look at alternative solutions to be able to support their employees if that's something that's of interest to them. Um, uh, so that's a trend that we're going to be keeping an eye on. Again, IVF specifically and abortion coverage, that's something that we think the HRA can actually provide an alternative solution and some real value there as we look at that market. Um, Cost sharing was another big kind of trend of this year, right? As many of you probably know, new kind of federally enacted rules mandate that enrollees have real-time access to cost estimates and a real understanding of their cost sharing details as it relates to fully insured group health insurance plans. Um, I think, the real interesting kind of trend here is, do our employer groups actually think this increased level of transparency and data is going to be helpful to their employees? And you see that, roughly, 41% believe it will be very helpful. 38%, think it'll be somewhat helpful. Um, and so I think, what we're really starting to see here is do employees understand when they're making a decision on health insurance, exactly what they're getting and ultimately what their potential future cost sharing and responsibility might be. Oftentimes what we see is that employees are not well versed in that, whether they're on a fully insured plan, whether they're using an ICHRA and they've transitioned to the individual market. And so as we're thinking about bringing in solutions to the employer market, providing a level of transparency and education and trust is going to be critically important, as it always has been. But I think is going to continue to be important to ensure that, as things shift with health insurance plans, employees are really understanding what the end result to them is. I think there's a long ways for us to go, both on the individual health side, but also in the group space in terms of, tooling and resources that can be available to employees at the time of enrollment for them to really understand the decision that they're making, whether that's, AI based, whether it's real time, tooling that help employees work through scenarios. But it's really about this process of how do we make the what can feel like a really burdensome process of both understanding and evaluating health plans, a simpler, transparent, easier process for employees. Um, we obviously, as an HRA administrator, really focus on the ICHRA and the QSARA market. And so, with everything that's been happening in the fully insured market, what have we seen in the ICHRA and the QSARA market? And, no surprise, adoption of ICHRA and QSARA has increased year over year. So there was about a 30% increase of groups that were adopting the ICHRA from 2023 to 2024. I think the real interesting thing here, and I'll talk about some of the smaller trends, but also the really, really interesting trend here is that ICHRA adoption for ALEs, so those employers that are federally required to offer a health insurance solution, that coverage grew 84%. So adoption of the ICHRA grew 84% in the ALE segment. That to me is a meaningful sign that employers are starting to take this seriously. They're seeing, hey, I can provide a compliant solution while also really being able to contain costs, not maybe only just in the year that I'm switching, but really in a sustained way, and provide more choice to my employees, right? The fact that ALEs have started to move over to the ICHRA and done so in a pretty meaningful way year over year, I think is it's a real sign to all of us that are in the benefit space and that are benefit advisors, that this has to be a part of our package. If you have ALE groups that are on fully insured, this has to be a part of the solution. It has to be a quote that you're showing them, and an alternative solution. Are there, switching costs? Absolutely. Do they have to understand the process, what it's going to take, what it means for their employees? Yes, there is an education part to this. Um, but to me, the fact that ALEs are starting to see and really feel the pinch on, continued premium increases in the fully insured group space means this has to be an alternative, and we're starting to see that. Um, I think the other interesting piece here is a massive part of the market, that of employers that have adopted ICHRA and QSARA, have not previously offered health insurance, right? So when we think about, there's two ways that the ICHRA can grow year over year. There is taking market share, right, which essentially means it is an alternative solution for those groups that no longer want a fully insured solution. Or it's groups that have never offered health insurance before and we're really net new adding groups to the coverage. That is still a massive part of the ICHRA and the QSARA market, right? Groups that maybe have always thought that offering health insurance wasn't in budget. The ICHRA and the QSARA give them a way to be able to offer that in a format oftentimes that's very budget friendly, and allows them to provide a benefit to their employees without breaking the bank and being concerned about what those annual re-rates are going to look like if they're on the fully insured plans. Um, we talked about this, right? 83% of that market is first time coverage. I think that number is going to, continue to stay pretty high, I think, for the next probably, I would say 12 to 24 months for the next open enrollment and potentially the year after. But I think as ICHRA and QSARA, and again, when we see those ALE adoption numbers, if that continues, that trend continues, you're going to start to see the first time group coverage, is going to start to become a smaller piece of the pie because you're really going to have groups considering a switch where they've offered prior coverage, but now really want a cost containment solution. Um, um, I think when we look at the ALE space, right? Um, 2024 really has been an inflection point for the ALE space. I think you're going to see this trend continue in 2025. Um, but really, what we're seeing and what we're hearing from both our broker partners, but also ALEs that may have ICHRAs with us specifically, is it really comes down to two things. Number one, it is a big piece of cost containment. Again, not just switching the first year, right? We may be able to drive 30, 40% cost savings in that first year that you switch, but it really presents a systemic shift in how employers think about health insurance, right? So if I'm an ALE and I'm required to offer health insurance, I've been used to, hey, we're going into renewal season, we're going to have to budget for an increase. We're looking at, again, if I've looked at this and provided health insurance for the last 5 years, on average, my premium's now up 24% from where it was in 2019. Um, when you think about what happens with the ICHRA over time, it actually provides a more stable, predictable cost line item for your employers because their cost increases, especially in the ACA, or excuse me, in the ALE market, are oftentimes going to be they're going to be insulated because their employees are now in the ACA market. ACA market increases over the last 10 years have sat somewhere between 3 to 5%. And so you're seeing a lot more stability in the ACA pricing, which ultimately for our employers means as they think about for projecting for the next several years for their costs and they're thinking about their benefits package, there's going to be a lot more predictability there. Where do we kind of, as we look to 2025, right? We're in open enrollment now. As we look to 2025, where do we see kind of key areas of opportunity and growth? The first is, continued cost pressure. We're going to be running some numbers, but, I can anecdotally tell you as we've been through this open enrollment, the key thing that we've seen as our broker partners have referred over ICHRA and QSARA cases has been, hey, this employer got a 30% re-rate, 20% renewal increase. We're seeing a lot of double digit and not just double digit, like above 20% annual increases this year. again, I firmly believe at some point there's going to be a breaking point where employers are going to say, we just can't afford this anymore. We have to look at something else. And so, as we see kind of continued cost pressure coming through this year in open enrollment, but also potentially into 2025, that's going to be a massive opportunity for our broker partners to be able to present a real value added option to those employers that are looking for an alternative cost-effective solution to their fully insured group health. Um, this year is also going to be interesting for Indiana, right? We've talked a little bit about this, but in 2024, the Indiana State Legislature passed a tax incentive essentially to employers that were going to offer ICRAs. We're going to see how the data kind of plays out this year, but if we see ICRA adoption in Indiana really start to grow, you might see other states come in and put in similar incentives. I'll pause here for just a minute and mention something that's actually not in the slides. I think one of the questions that we often get from our broker partners is, we talk about kind of state incentives for HRA utilization. What do we think the incoming administration is going to look at in terms of HRAs? You know, I think at this point it's anybody's guess, but there's a couple of things I think that probably do hold true here. Number one, the ACA market now at 21, 22 million people on there has become a pretty sizable piece of the insured population. I think it's going to be really difficult. And the question is whether there's enough political capital to try to make a real meaningful change in how the ACA operates. I think that's very difficult given the size that it's gotten to and the fact that, there are a lot of sections of the country that are heavily ACA populations that are actually, it's in the best interest of the administration, the incoming administration, to continue to allow those individuals to be on the ACA market. I think the big question that is really outstanding is what happens with tax credits as we move into 2025. Again, that's anybody's guess, but I think that could end up having an impact on what the ACA market looks like as we move into 2025. Two other areas I want to mention here is, the technology in the HRA space has continued to get better. But I think, there is a real massive opportunity for all of the ICHRA administrators out there today to really be pushing better technology and better tooling, both for our broker partners that are assisting their employers in understanding and making the transition if they are going to make it, but also as we mentioned a little bit earlier, decisioning tools, right? Making it easy for employers to understand and make the decision on whether or not they should make the switch, and tooling for employees that are now going to be moved into the ACA market, really helping them understand what options are available, what costs are available, and being able to enroll there. Um, you know, the I think to me the really big opportunity here is as we think about things like family planning care coverage or abortion coverage or, deductibles that potentially could go up. That's really where full customization with complete cost control, right, is a massive area of opportunity and value add for our employer group. So what do I mean by that? HRAs are incredibly flexible funding structures. Groups can add them to existing group health insurance. They can use an ICRA and then have a significant amount of leeway on what they want to cover and how much they're going to contribute towards that coverage. So we have found that it is always more cost effective to, if you're thinking about fertility coverage, for example, offer an HRA that covers specifically fertility coverage with dollar for dollar, dollar coverage. Rather than looking at increasing premiums across an entire group. So that is really where HRAs can be incredibly powerful solutions that can help you offer um, creative problem solving to your employer groups. Very quickly, for us as an administrator, we administer and can and offer all types of HRA plans. So really think of us as your thought partner, your design partner when you have employers that have certain challenges or certain things that somebody else might not be able to help you with. We really bring kind of the design expertise and ability to administer, whether it's a standard HRA, the ICRA, the QSERA. We can really help you implement and design a plan that's going to be interesting to your employer groups. And with that, want to thank everybody again for joining today, and I will open it up for any questions that folks might have.